Component task on conducting abdominal examination on a pregnant woman. 1. Explain procedure to client and ask client to empty bladder. 2. Provide privacy and put client in recumbent position. 3. Wash, dry, and warm hands. 4. Stand by the right side of the woman and expose abdomen only. 5. Perform inspection and measure symphysiofundal height. 6. Perform fundal palpation. 7. Perform lateral palpation. 8. Instruct client to bend her knees slightly and breathe slowly through her mouth. 9. Perform pelvic palpation and assess head descent. 10. Listen to and count fetal heartbeats. 11. Assist client out of bed to redress and communicate findings to client. 12. Wash and dry hands and record findings. Thanks for watching. Remember, subscribing does not cost a penny. Thanks, elite nurses. Check out our playlist for all your component task videos under 2 minutes.